Hi, my name is Bret Barker. I'm the CEO of UberWoundCare Incorporated, 288 Zanker Road, San Jose, California, suite number 203. I'd like to talk to you about a problem in America. There's 6.5 to 8 million chronic wounds per year, depending on the literature that you read. It's about a $30 to $33 billion a year problem. And I say problem because it's exactly that, and we can fix this. UberWoundCare was created to help fill the gap to get licensed providers out to the patient where they are. They can't always get to the emergency department unless they got brought by an ambulance. They can't always get to the wound clinic. They may or may not be able to make that wound debridement appointment that they set every couple of weeks or every week when they really need to get there. They may not be able to always get to that hyperbaric chamber therapy also. Some people need to take a half a day off of work. You need loved ones to coordinate transportation. All these issues keep people out of hands-on licensed provider care. Home care is great, and we can get a lot of people out there, but we need more boots on the ground to get this problem solved. So to do that, I'm going to crowdsource licensed nurses. I'm also going to use telemedicine for wound assessments and consults. So physicians and nurse practitioners on the other end of a HIPAA-compliant video screen, utilizing a mobile device just like a patient that downloads from either Google Play or iTunes or Amazon App Store, can talk to the physician remotely and show the physician or the provider their wounds, and then can make a plan of care based on that. From there, we're going to send out the supplies to the patient's location. The patient will then either have a nurse assigned to them, or they'll be able to go to our provider network and find a nurse or physical therapist or somebody that does wound care in their local area. The idea is if the nurse is working, they can get off work, on their way home, stop in, do a half an hour wound care assessment and management episode, take care of that patient, and get on their way without having to go too far out of the way. Talking with lots of nurses, they're very interested in doing this to be able to work per diem 2 to 4 hours per week. Not everybody wants to work an additional shift or just do home care. Not that there's anything wrong with that. They just don't have the time. But there's 3.44 million nurses in the United States and 810,000 licensed physicians. And we have all these people that can definitely use our help. So let's give it to them. So we're going to have licensed nurses with their own liability insurance signed up. We're going to do private duty. We'll do contract work with home health agencies so we can take care of their wound care program. We can get in there and bill them separately so that they don't need to deal with it. They can worry about the other parts of the patient's care. We can use advanced therapies. We can use concentrated evidence-based practice therapies, but we will get in there and we will get these wounds healed if you give us a chance. We're going to work with discharge planners, hospitals, primary care providers, urgent care centers, whoever we need to make sure that everybody involved is aware of the patient's status, so it's readily available and we can get these wounds managed as they should be and get them healed. We want to get wound closure. We're utilizing VC for our video conferencing right now, which is a wonderful way to do that. We have a virtual waiting room we can log into, set yourself up, put in your credit card, insurance information. We accept your copay, do your 5 to 15 minute telephone consultation over your mobile device, show the provider your wounds. We get a quick picture taken and we get somebody out to your home. Once they get there, we utilize tissue analytics. They have a little green dot. It's 3/4 of an inch diameter with a Pantone color that automatically allows us to measure that wound size accurately and get an accurate surface area. No more measuring tapes, no more rulers. Only thing we have to do is measure the depth. So a provider does need to be out there to do that. After the provider leaves, we can show the patient definitely how to do that for future uploads. We can utilize Luxtra, RTD, we can use Nutriphase, hypochloric acid, wound care cleansers, and various types of activities to reduce biofilms and get these wounds healed a lot quicker than we probably could. And the reason we can is because we can get people there faster, more often and faster. We have a typical feed type in our Wound Expert electronic medical record, which shows exactly what the wound looked like the last time the provider saw it. We have a running trend on that with all the photos. We have all the tissue analysis, so we can easily manage these wounds by getting people out there. Consider a nurse who gets off work at 7:30 in the morning. They can swing by a patient's house at 8 a.m. or go to their office for that matter. The supplies are already there. They can take care of that wound. Any outliers, we'll have those referred out absolutely. If they need to go get debridement, if they need to go to the emergency department, if they need hyperbarics, we would do those other additional things to make sure that they got to the right location. But for a large majority of these wounds, we can get out there and we can take care of them right away, pretty simply and pretty quickly, efficiently and inexpensively. So when it comes to insurance payments, accountable care organizations, and reducing the overall cost of doing the care for these patients and keeping them out of the hospital overall and making sure we can not get into a position where we have to worry about limb salvage, we can do that. So join me. Climb on board. Let's change healthcare for the better. Let's take telemedicine mainstream. Let's crowdsource licensed staff. Let's get people out there touching patients where they need to be. We have 17.9% of the population living in rural areas. 15.4% of those are nurses that live in those rural areas as well. This is not just for rural programs either. We can get out to metropolitan areas wherever you need to be. Not everybody can get down the stairs or out to a bus stop and get down to a wound clinic. There's only about 1,000 freestanding wound clinics in the United States anyway, 20 per state. Come on. There's 800 plus hospital-based wound care centers. That doesn't give us enough. 4,722 patients per facility per year. That's not going to happen. I would love to have 18 patients a day. We would have more work than we wanted. Let's try to get this problem resolved, and then we don't have to worry about that. Again, I'm Bret Barker, CEO, UberWoundCare. Please join me. We have an application coming out very soon. We'll debut to the market, and then we'll let you play, and we can get these problems fixed.